Good evening. One of the sort of many sources of delight at the Conduit is that you get to arrive and listen to an evening such as tonight. And to be able to take the N Fund and Virgin Unite, obviously the independent philanthropic organization that is works as part of the Virgin Group, but also the Branson family, a group we've worked with for many years and which I have deep personal links to. And the N Fund, a really essential organization that is seeking to eliminate 6 relatively unknown diseases with almost unpronounceable names that affect and continue to blight the lives of over 1.6 billion people. And to be able to have these two remarkable institutions united in trying to address this in a thoughtful and systematic way is so important and such an honor that you're all gathered here today. The intersection between these two matters, it relates to a broader interest of ours at the Conduit, and we've launched earlier this year a thing called the Conduit Solutions Agenda, one of which is particular focus throughout this year on the relationship between climate change, the climate emergency, and global public health. On the first day of London Climate Action Week, we are hosting a major conference in partnership with the Wellcome Trust here at the Conduit to try and draw linkages between these two seemingly disparate but wildly interconnected fields. And I'll end with a sort of framing statement, which we are trying to push as hard as we can at the Conduit. And that is that all too often as humanity, we come to problems when it is too late and we underinvest and we deal with symptoms. And this relates both to climate and to health, that a set of wise interventions early on can forestall both the enormous human impact but also the tremendous cost. And so I think tonight what you'll hear is a set of thoughtful strategies about how a penny in prevention is worth an enormous amount in amelioration. And I think at this particular moment in history, we have to be allocating those pennies. Hopefully, as results tonight, will be significantly more than pennies, but metaphoric pennies, in getting ahead of these problems. And so I invite the panel up to say a few words, and we're very excited to have you here. So thanks for coming. Okay.
Hello, can you hear me? Fantastic. Well, thank you so much. Thank you so much, Paul, and to the Conduit for hosting us here. Obviously, they are very interested in the topic that we're speaking to tonight by bringing attention to the intersections of climate and health. I'm going to say a few opening remarks, and then we have a wonderful panel of experts to talk about this issue of the nexus of climate change and health interventions. So I'm Mireille Cronin-Mather. I'm Vice President of Investor Relations for the N Fund, and you heard a little bit about the N Fund. We work to eliminate neglected tropical diseases, and it's happening thanks to the collaboration of many in this room and to representatives like people who are on our panel. So Eid Mubarak to those who are celebrating. What a wonderful time to be in London. The weather is just amazing. And I know many of you are here to go on to Skull World Forum in Oxford. So thank you for stopping by here first. We really appreciate it. And thank you to Virgin Unite, who is our co-host for this panel. We're here to talk about the intersection of climate and health. And climate change, as we know, poses the most significant threat to human health today, with extreme weather events placing additional pressure on communities that already have fragile health system. And it's usually pressure on communities who have contributed the least to the problem. And we're really concerned that this is going to set back much of the advancement in health that we've seen really accelerate over the last couple of decades and to impede the achievement of the Sustainable Development Goals. Now, last year, there was a World Health Organization review that looked at the impact of climate change on infectious diseases significantly, and it revealed many gaps in evidence and a lack of representation by the communities who are affected by climate change. And I was really impacted by kind of the opening paragraphs of this, so if you'll bear with me, I'm just going to read a few lines from that review that was published in the Transactions of the Royal Society of Tropical Health and Medicine. And so it said, climate change will perturb human health in profound and lasting ways, both directly and indirectly. Multiple direct and indirect mechanisms will contribute. Human physiology can be affected directly by changes in air temperature, humidity, stress, and diet. Human behavior can be altered by changing weather, changing economic circumstances, migration, natural disasters, and access to or quality of healthcare. Environmental conditions can also influence pathogen transmission, reproduction, development, and genetics. The reproduction, development, genetics, behavior, range, longevity, and predation of vectors, which we are very interested in, intermediate hosts and reservoir hosts, and the feasibility and effectiveness of interventions. In fact, there is already empirical evidence of climate change having amplified more than 1/2 of all known human infectious diseases. So that's very clear in the way that climate can impact health and in the area of infectious disease. For the End Fund, we work on neglected tropical diseases that impact over 1.6 billion people today, 1 billion of those being children. We're very concerned about the impacts of climate on especially the vectors of these diseases, which are flies, mosquitoes, worms, and how climate change can spread these diseases to new geographies where they haven't been yet. We've had some remarkable successes in neglected tropical diseases. Many countries are eliminating. In fact, just recently, Niger announced the elimination of river blindness, which is a disease that used to affect about 20% of the population there, and now it's gone. Now it's history. Senegal is about to announce as well. But these impacts from climate change must be addressed in order for us to continue that progression. So, but many of those, the impacts on climate health can exacerbate what we know are the existing challenges in public health today. And that includes inclusivity of the communities who are impacted, evolving the infectious disease science and tools to adapt to climate change matters, and the policy and funding environment that needs to also grow and adapt to deal with these new challenges. So I'm very excited to now begin our panel discussion with these experts to my left, and I'm going to do a quick introduction of each. First, we have Dr. Matika Mwenda, who's here just to my right. He's a public policy advocate for climate and justice based in Nairobi, Kenya. He serves as the executive director of the Pan-African Climate Justice Alliance, a 2,000-strong consortium of African organizations, and we were chatting earlier, and he was saying some of those organizations are from more formal groups, community-based organizations, to groups of community members in fisher communities. So it's quite a wide range of community members that his Climate Justice Alliance represents. And he advances a people-centered, bright space, just, and inclusive approach to environmental challenges. So thank you, Dr. Mwenda, for being here. Kira Judge, soon to be Dr. Kira Judge, is an award-winning scientist and science communicator working at the intersection of biology, computation, and health. She is a PhD candidate in infectious disease modeling at the London School of Hygiene and Tropical Medicine, where she is working on new methods of tracking and mapping outbreaks that use both epidemiological and genetic concepts and data. So welcome, Kira. Thank you for joining us. Finally, we have Dr. Alan Dangour. Thank you so much. He leads the climate and health team at Wellcome Trust, having previously spent 20 years at the London School of Hygiene and Tropical Medicine, where amongst other positions, he was director of the Center on Climate Change and Planetary Health. Thank you, Dr. Dangour. And so we'll get right into it. And we have quite a bit of time before we'll open up to the audience for questions and make this more of a dialogue. So first, Dr. Mwenda, you work on Pan-African advocacy, influencing policy at national and regional levels. You ensure community voices are represented, and you focus on equity and climate justice. And we were talking about how your alliance has looked at the intersections of different sectors of climate and education and climate, and now you're looking at the intersection more formally of climate and health. So thinking about equitable climate action, recognizing that Africa is disproportionately impacted by climate change, what are the most effective solutions that you've seen that can be implemented to address the health challenges that climate
Thank you
presents?
very much, and it's a great pleasure to share a platform with these prominent panelists. I'm just, before I go to the equitable solutions, I just want to draw attention of really what we have experienced as an organization, as a person who has participated in the international climate discourse process at a national level, at subnational, at continental, and global. I have attended and participated in the shaping up of the Paris Agreement. I came at the tail end of the Kyoto Protocol, which was more government-driven. Actually, it was parties. Parties are governments. And so I've seen the evolution of climate discourse process from a more scientific and environmental issue only being an issue of science and environment, now to after Paris Agreement, which became broader, though it is voluntary. Of course, some people believe that the Kyoto Protocol was stronger, but now it looks broadly and looked at the intersection of all sectors, so that now for the first time, it acknowledges the role of non-state actors, philanthropy, civil society, private sector, and all. So I think that was what was not there. And now, over the since 2016, the discourse on climate change has evolved to involve sectors, because it has been acknowledged that climate is everything. As Naomi Klein said in her book, it is about everything. It is about development. It's about health. It's about equity. It's about the science. And it's about agriculture. It's about everything. So looking then into that, then into this talking about climate, we need to look at the challenges. And I have distilled, before I go to the solution, distilled this into 4 categories. Category 1, the primary concerns and challenges, which the social determinants of health face: water, health, the nutrition, and the water, health, the ecosystems, and those others. The other one is the secondary one, is the resilience of health systems. How are we going to make them resilient? And the tertiary concern is about the climate change and its implication on biological, resources, because most of them, pathogens and even plants, for instance, the one we produce, penicillin, are being affected by climate in one way or the other. But there is also the global decarbonization agenda. Climate and energy is very important. We need energy for, first of all, for the energy in the transition to low carbon, climate resilient future. It's very important because we need decentralized energy systems to ensure that the communities which are not who cannot access the national grid are reached. This is actually an added advantage. If we in this process, it benefits the health sector. But also we need energy in the medicine and the food preservation. We waste a lot of food, which is because of preservation, but also medicine. Look at when there was COVID-19, reaching out to remote communities. the decentralized energy system, solar power, you know, it can be erected anywhere. It can be the solar, wind power, and so forth. So there are benefits out of that, which now are benefiting all the systems, like now the preservation. So then let me come then to the question which had been asked about the equitable and effective solutions. So this is very important, because that is what we have been really tackling. Really, how do we ensure that climate discourse process, we have in the climate, the climate justice movement, the distributive justice, the restorative justice, but more importantly, the procedural justice. The discourse on climate change has always been top-down. So we need to decentralize this, because the people at the front line of climate crisis, the ones who are suffering malnutrition, the ones who are, when it rains, who are affected by floods, the waterborne diseases, are the people at the local level. They have never involved. And so, how do we then ensure that this interaction and the policies which we are doing within the principles of locally led climate action, and believing that organizations like Welcome and those others trickle down this discourse, is not about doing policy documents. It's not about really the elitist kind of discussion, but how are the people at the front line really contributing to this leadership, to this one? And so leadership is very important as one equitable and effective way of ensuring that the consumers of our policies are part of the discourse of shaping those policies. That is what we have lacked. The other one is, of course, how do we ensure that in the discourse, like in Dubai, for the first time in Dubai COP28, we end the climate day. That actually was progress, because the discourse on climate and health has always been peripheral. Though we still have a challenge, we need to ensure that that is mainstreamed, not only during the course, but even the discourse at national, regional, and sub-regional level, but also sectoral thematic. How does it interact with those who work on water? Because that's a determinant, social health and determinants of health. How does it interact with the water? How with the waste management, sanitation, and those others, food discourses, and those others. So that is what we have not seen. So the evolving discourse on climate and health should not be an isolated effort. We need to avoid silo way of working, because that is the biggest challenge we have been having. So the policy, research, and the practice should go hand in hand. I know many organizations, Welcome Trust, Ed Fund, and even us, we have been convening meetings at the African level, interacting with the African Union, for instance, the UN, WHO, and so forth. But now what we are trying to do is to try to see how we can avoid as much as possible in the climate constrained and the resource constrained world, how we can put all efforts together so that we bring everyone, so that when we are not discussing about only health, we are discussing climate, and bring those who discuss food, they are in the house. Those who discuss education, they are in house. Researchers are in the house, and everyone. More importantly, the people who are affected by our action, the end consumers of the policy like this one, which I've seen, which we have contributed. The question is, are we going to be developing them for academic purposes, but for people really to understand that there is a challenge, because that is where there is a disconnect.
Thank you so much, Dr. Wendy. Powerful words about making sure that we're not just creating policies and interventions at a global level and then imposing them on communities, but really bringing communities to the forefront who are affected and working in an integrated way. We heard that, and I think now more than ever in today's resource environment, that's going to be the rule of the game. Thank you for pointing to the document that we collaborated on with you. It was created in response to that WHO review with recommendations for how we can move forward with the climate and health agenda, including approaching in an inclusive way. So thank you so much, and for that. We'll come back more about inclusivity. Kira, so we know that in order for us to advance in the pathway, in the intersections of climate and health, our tools and our scientific research also needs to adapt. Can you share some of the things that you've been focused on recently as climate becomes more to the forefront?
Yeah, sure, absolutely. So just to give everyone, I guess, like a little bit more context for my PhD, I've been working on developing methods of modeling that's tracking and understanding the spread of diseases that not only take into account things like disease occurrence, so where and how often it's happening, but also the genomic information about the data in question. So the best example of this, I think, is during the COVID-19 pandemic. You went and you got your PCR test and someone stuck a swab up your nose and it was very unpleasant. And there was a small probability that swab would be randomly sampled. The genome or the genetics of that, the DNA of your swab would be read, the disease, not you. And all of that was put into this global database that researchers were using to track the spread of COVID-19. And it's interesting because that example brings me right into what I think the problem is, which is that we can use all of this information to better track the spread of disease, and that's great. But during the COVID-19 pandemic, there was huge disparity globally in terms of the frequency of how much genomic sequencing was happening. So that led to a couple of issues. First of all, at one point in the UK, as much as 15% of your swabs were being tested, which is great. There's a lot of information there. South Africa, similarly, was a huge pioneer in conducting genomic sequencing. But then what happened when South Africa discovered Omicron? The world shut down to it. So data is incredibly important, and that's what it's all about, really. We can work on innovative methods to do our best with the data that we have, but it always comes back to gathering data. And that's where there are a few problems. So first of all, we have this problem of decolonizing global health, when South Africa discovered Omicron, the world shut down to it. So what's the motivation of a country like South Africa to keep informing the rest of the public and to keep its genomic sequencing coverage high? Secondly, and for this I'll kind of call to memory my more recent work, which has been looking at yellow fever in Brazil. There is nothing that I will know about yellow fever in Brazil from my lovely desk in London that the local people that had to deal with the recent sylvatic outbreaks of the virus in the late 2010s won't be able to tell me. So collaboration across countries with data sharing information and working together is incredibly important. So I think that's why, I guess the question was about like what innovative methods we're coming up with, and that's absolutely incredibly important. But it actually links back to your previous question about climate justice and decolonizing global health. We need to start working together and really valuing indigenous and local knowledge and grassroots solutions, because that's where the data comes from, and that's where the interventions are implemented at the local level.
That's amazing. So an investment in data sharing from the places where the diseases are occurring has to happen in order to then devise the correct solutions, the most effective solutions.
Yeah, absolutely, and it has knock-on effects as well. It provides employment. There are incredible scientists in the global south that are more than capable of doing this work, and it's about investing in the right places and moving the investment in studying these diseases to the places that are being affected by them, because ultimately local knowledge, lived experience, indigenous knowledge is irreplaceable when it comes to tackling diseases like this.
Amazing, fantastic. We know that we see that firsthand with our mentorship program that we support for the next generation of NTD scientists on the continent. So thank you for that. Alan, thank you so much. You are focused on collaborative philanthropic investments in health and climate change and influencing the global direction of philanthropy towards these more sustainable and inclusive approaches. So an integrated approach to climate and health is a priority at Wellcome Trust. As demonstrated by your recent $25 million grant to the WHO on the health effect of climate change. Have you seen other funders take this approach? And if not, what messaging do you use in your peer community to invest in this area?
Thank you very much. I'd like to start with a few opening comments. I've just come back from a weekend in Wales, glorious, glorious sunny Wales. For those of you that aren't from the UK, it's always sunny. And so I'm a slight bird watcher, and the birds are very heavily at it at the moment, if you'll excuse my French. But it's incredibly moving to see nature spring back into life at this time of year. It's incredibly energizing and gives one hope when you see nature. And not only the birds, but all the trees coming out and the flowers. And Wales is about 2 weeks behind London, so there are daffodils still in the fields and everything. It's absolutely stunning. And we are absolutely at risk of losing it all. So I love your quote, Murray. Climate change will perturb global health. Climate change is going to destroy global health. And we're already seeing it. So there is a sense that we are coming to this really, to go back to Paul's comments, we're coming to this really quite late. The signals have been there for us for some time, and we as a community have not acted, and there are loads of reasons we haven't done it, but it's kind of now or never. We really must now make concerted action. And that's why Wellcome, about 3 years ago, started a new strategy on climate and health. And you know, your point about it not being a silo is absolutely critical, and I'll talk about why it's not a silo in the way we do this. But we started a new strategy on climate and health. We made a commitment. Wellcome made a 10-year public commitment to spend £16 billion over the next 10 years on research in 4 areas: discovery, fundamental biology, that is, on human health, mental health, infectious disease, and climate and health. And we did that because we recognized that this was the greatest challenge for global health. And we recognized that the other philanthropies were not stepping forward. Global health philanthropies focus on their areas, their disease, their whatever. And this intersection, this siloed approach is not going to get us out of this enormous hole we're in. And only by informing global health with climate, so these should be climate in all decisions from now on, whether you're buying a house or deciding on which vaccine to invent, it's got to be informed by climate change. It's got to, because the world is changing so fast. So we made this decision that we would become a major funder in this area. We are by far and away the largest funder on the climate and health intersection. And that allows us to do multiple things. We do a huge amount of calls for research, innovative. There's one live at the moment if you're interested on climate impacts. But we do a huge amount of funding calls, but we also make strategic investments such as our support for the WHO. Why did we invest in the WHO? Because we've been lobbying hard, as have others, of course, to make sure that the next program of work for the WHO, the next, the health strategy for the world for the next 4 years, actually contains the word climate change. So we pushed very hard, and the WHO have recognized that, and the #1 strategic objective of the next general program of works, GPW14, is to prevent the impacts of climate change on human health. So that deserves a bit of a round of applause to WHO, but also a major investment from us to say, okay, that's fantastic, we're fully behind you. We want WHO to integrate climate across everything it does, and we're supporting WHO to do that. So those sorts of strategic investments can be very powerful. But what they also do is that they bring in other funders, other philanthropies, and what we can do as a leader in this field is talk to our peer philanthropies. We have enormous convening power, which is a great privilege. We don't take it lightly. We also have an enormous endowment, which is also a great privilege. It enables us to do things which others can't. And so I'll give you 2 examples. In 2023, we wrote a report with Climate Lead, which really set out a set of options for other philanthropies in this space. So number one, what is the ecosystem around climate and health? What sorts of things can you do? What are the topic areas? What are the themes? What are the opportunities? And we gave some examples of how philanthropies, big or small, can join in the mission and identify areas where they're interested. So, of course, we largely fund research. Others will fund advocacy. Others will fund community building. Others will fund policy. And all of that is important, and advocacy and other things. And all of that is important. And we welcome can't do it all. So bringing all those philanthropies together is a really useful thing to do. And then this year, towards the end of last year, in partnership with Rockefeller, we set up the Climate and Health Funders Coalition, which is largely for philanthropic funders. And in those meetings, and if you want to know more about them, Erica is sitting at the front here. She just smiled at me, so I know, so I can pass that one on to her. In partnership with Rockefeller, we meet regularly now with a very senior bunch of philanthropies, largely from the global north, but increasingly now also from low and middle income countries, to really to share knowledge, to share information and insight, but also to share opportunities. Hey, we're doing this, do you want to come in? Or what are you doing, can we partner with you on that? And we have themes in that coalition. So if you really care about heat, there's a heat subgroup. If you really care about data, there's a data subgroup. So we're doing it like that in order to crowd in the resource. Wellcome is huge. Yeah? Not as big as some of the others, but Wellcome is big. So it gives us an opportunity to really shape what happens, but we also recognize that we're just one philanthropy. And if we could bring the others with us, if we can work in partnership, there's so much more we could do.
Fantastic. So your convening power, you're leveraging to pay a lot of attention to this area and influence. Thank you for that. It's exciting to see what will come of that. I think, getting back to what we were discussing in the beginning about making sure that the priorities of the communities that are most affected by climate change and the health issues that then will follow is something that we at the End Fund want to make sure that we hold as a driving principle and value of our work. We partner directly with governments in the countries that we work, with the communities, with local experts, and making sure that the policy-making environment values that just as much as the local implementers do. It is something that has to be essential to the response to and addressing the impacts of climate change and health. So I'm going to go back to you, Dr. Mwende, with Mithika, again, thinking about how communities can shape climate and health policy. So you work with so many different groups. Can you share a little bit of insights on your process on how you source, the most effective knowledge in the different sectors that you work and how that might be applied to the health sector to really influence the policy environment that we need to see moving forward, especially at this time of changing dynamics in funding and where resources that are sourced much closer to home need to be taking a really strong look at the most effective means of applying those resources.
Yeah, so it's quite, as I've just mentioned, the question has always been how do we capture the voices of the communities at the front line? Because in the discourse itself, it has been very difficult. Where do you seek the issue, for instance, of climate change and what does it manifest? Just to give you a picture, when there is drought, so what sector manifests, where the manifestation of climate change impact is seen? It is at the health sector, but this has never been acknowledged. Who are the responders when there is drought, and then you see the images of malnutrition in pastoralist communities, like in our Horn of Africa, where you see, malnourished children, the very, emaciated. So that emaciation Who comes in? It is the health sector, but that has never been acknowledged. When there is flood, and there is that waterborne diseases, like it happened in Eastern Africa just recently, what do you see? You find actually the responders are the health sector, the Red Cross, Red Crescent, and those others. But do we really acknowledge that? So in our, for instance, now we are in the policy making process of what we call the nationally determined contribution. Right now we are in the countries are in the process of submitting the DANT 3.0, NDC 3.0. And what we are discussing is how it's not about who are the ones who are on the lead, who are driving this process. The principles of locally led climate action, which have been largely driven by the civil society to ensure that those at the front line are involved and really have a role in shaping those policies, may it be NDCs, may it be adaptation, policies, the global goal on adaptation, which we are also, it is stuck at the negotiations, is to ensure that what is the role of agriculture, for instance, what is the role of the health sector, what is the role of water sector. And so we are exceedingly seeing very incredible progress in terms of ensuring that it is not just a dry discourse, but it is really driven by key sectors. So at now climate and health intersection, I think we have seen progress, and what we need to do, how do we bring on board ministries of health, for instance, at national level, because that's where it starts. You cannot talk about World Health Organization without talking at national level. How are we going to involve those midwives at very local level, and how do we feel their voice? How do we, the health volunteers at the very community level and in the decentralized systems of government? What change do we want to see? So largely, the top-down model of engagement has failed dramatically. So what we need to do then is to see how we can use the pillars already established on health sector, without really trying to see how we can replicate, because the bigger challenge which we have been having so much is there is now funding from Wellcome Trust, and we go and form an organization so that we drive that. We know that there is a donor cluster, so we need to really build on already established infrastructure, particularly in Africa. We are trying to see how we can avoid parallel events, parallel mechanisms, parallel processes, so that now we maximize on the resources which exist. And actually, when I came this morning, I entered a discussion, I visited the Wellcome Trust. So this is a very practical way of doing it. So I was asking, what are your priorities in the next 5 years? They have established 3 centers, science centers in Africa. So the question is, PAGJA has established very wide infrastructure in the policy processes, working with the African Union, working with the UN Economic Commission for Africa, working with the African Development Bank and those other actors. So the question is, within that, then what you are lacking is the health sector. How do we ensure that we bring it and then without necessarily introducing a parallel process which may take ages to catch the pace when the discourse is ongoing? Remember, this discourse is time-bound, and what was being discussed last year is not what is under discussion this year. What we are targeting towards COP30 is not what we were targeting last year. So where would be the role of the health sector? The other point which we have to really understand is the eventful way of doing things. We have to acknowledge that this is a process and not just an event. The fact that we have just little money to have a meeting like this, it doesn't end here. This will not, even the COP30 will not solve the health climate problem. What we need to do is to engage in a continuous and sustained processes building on each other in such a way that each event, even this conversation, should be building on another one rather than starting something which is different. So Silo work, again, once again, is we need to desist on that, but also acknowledging the role of various actors at various levels. Even the top-down we are talking about, it is also important, also bottom-up. So we need to look at where does it converge, and that's how we are going to make progress in the conversations which we have and the change which we want to achieve within a particular period of time. Thank you.
Thank you so much. Such powerful statements. I really like what you're saying about we don't need to go from event to event, you know, where we say, this is what we will do. Hopefully at the next big event that we have like that, it'll be, this is what we have done. And we are well on our way there. And it's really about the work that happens in between that. It's clearly that you and your alliance are driving forward to make sure that there's continuous action and not just moment to moment. And you know, that continuous action, Kira, as we were talking about, is a continuous advancement and evolution of the science behind it, getting back to the science and the tools that we have. You made such a powerful example of during COVID with Omicron and South Africa, and how you know, the experience on the ground and the research from the ground really needs to drive forward and be adapted to more global approaches. You have such a breadth of experience at the London School and also with the We Are Family Foundation. Can you share a couple of examples about how policymakers and funders can exchange and engage a little bit more productively on the scientists that you've seen are doing really great work on the ground with climate and health intersection?
Yeah, sure. I think we all need to get a little bit more comfortable with the word inter. And I know that maybe sounds a little bit crazy, but as I was kind of reading through things in preparation for this event, it struck me, first of all, how interdisciplinary this conversation is. Climate and health are two fields in their own right, and their intersection is so large that it's almost an entire field unto itself. But if you look at climate and health data, they're stored separately. Most of the research is conducted separately. And the intersection of those two fields, therefore, is never going to be wholly efficient if you're coming at it from two aspects. Similarly, the intersectionality of responding to the climate crisis, activists coming together with the evidence generated by researchers is typically the most effective way to communicate. And then lastly, I think maybe to your point, this idea of intergenerational. So We Are Family Foundation has a excellent study that they brought out last year on the value of intergenerational collaboration and best practices for it. I think the way that I relate to it most, and it kind of speaks to your question a little bit more, is intergenerational collaboration as an early career researcher. So I am not even finished my PhD. I submitted my thesis on Friday. I'm a PhD researcher. Early in my career, I have been very lucky to have had experiences in policy, even at my early career stage, largely just thanks to my involvement with the We Are Family Foundation. But a word that has come up repeatedly tonight is the word silo. And that resonates with me quite a lot, because what I've observed in research is, you know, there's a very defined academic ladder. You do your PhD and you do a postdoc and you get maybe associate professor, and you get to the professor stage, and then policymakers start maybe taking your advice seriously. The walls between academia and research and policy are too high. They're siloed. And it's inefficient. First of all, policy literacy in researchers is essential. We saw that during the COVID-19 pandemic, as all of a sudden all of these scientists were having to explain their models and where they were getting their predictions from, and understanding how to communicate effectively with policymakers is essential. Similarly, scientific literacy on the policy side is equally essential. So bringing down those silos, I think, is a huge solution to these problems that we face, and just becoming more comfortable with this idea of the word inter. Now, it's not all bad. There is some good work being done on this front. I'm definitely plugging We Are Family Foundation a lot, but together with Care About Climate and Groundswell, they're working on the NDC Youth Clause, which is basically enabling young people to get involved with countries' nationally determined contributions, or their climate plans, which are due in September. On a similar note, the Global Climate and Health Alliance are running a series of meetings bringing together the interdisciplinary, so bringing together philanthropists, academics, civil society, to advocate for health inclusion and involvement in the NDCs. So definitely I think everyone in the room here should probably start getting involved in those meetings, because it's about the it's about working together interdisciplinarily and intergenerationally. And I think if we do that, we'll be faced with a lot less problems.
Thank you. Thank you for your sharing and being involved in that. That's so important for us to think about the future of philanthropy and on these urgent issues, which we can't wait. You know, the word perturbed is stuck in my head too. Like that doesn't quite cover it, does it? So, you know, we're talking about large-scale issues, extremely large-scale issues, and philanthropy also needs to evolve with these large-scale issues that will have multiplier effects, that will enable intersections, will help to break down those silos. And one of the ways to do that is through pooled funds. And I know that Welcome, as you just mentioned, are involved in creating those enabling environments for funders to come together to address issues at scale. Can you share a little bit more about Welcome Trust priorities in that area, and what are the benefits and maybe some of the challenges of pooled funding that you've seen?
Yeah, absolutely. So thank you. Just on the word inter, I did also read the blurb before I came out, and it said intergenerational, and I asked my son to choose my shoes. So there we go. Hence they look like they do. So the pooled fund question is a very interesting one. We've I'll give. I think, you know, as I was saying before, the space here is enormous. The need for us to come together is abundantly clear. I heard the other day that the climate and health space was being called is now being called a bit of a circus, because there's so many philanthropies coming into the space, and there's so many people saying, "Oh gosh, I've got to work on climate and health." There's so many organisations writing to me or ringing me saying, "How do I, what do I do?" That actually that need for some sort of steering, some sort of openness. And I think that's actually part of the question, part of the issue. A lot of organizations are very closed, and they keep their strategies to themselves, and they stick on their strategy, and they won't be shifted because the boss has told them you have to do X. I'm afraid that's really not going to get us anywhere, especially because the world is changing so fast, and you can't, if you wrote your strategy 5 years ago, it's out of date. It's very out of date. If you wrote your strategy on the 5th of January, frankly, it's out of date. So I think this need to be more flexible, to be more agile is really, really important. And I think so. I've got an example where we're working now in a tripartite arrangement between Wellcome Trust, the Gates Foundation, and the Novo Nordisk Foundation. So these are now the three largest global health philanthropies on the planet, and we're the smallest. Okay, so to give you an idea of the scale of Gates and Novo Nordisk. And we came together to say, okay, what can we do as three philanthropies coming together that we can do because we are coming together, and what are the opportunities here? And so there has now been an announcement, you might have seen it, on a major investment in antimicrobial resistance, research into new forms of antimicrobials. And what that does is two things. Number one is and there have been an unbelievable amount of applications for that. But it's really exciting to see the demand for that opportunity, that research opportunity. But also, I think almost more importantly than the funding, it's sending a message from three of the largest by chance, the largest amounts of money sitting in the bank, philanthropies, that this is a critical question that we need to tackle. It's very likely that there will be also work in an area related to climate, because of course I'm pushing that through the tripartite agreement, because we want to get the three philanthropies to stand up and say, look, this intersection of climate change and human health is absolutely pivotal. So there's a lot of work we're doing there in that sort of space to really bring philanthropies together. But I want to go back to, just if I may, just very quickly, to this point about if it remains a northern privileged exclusive bunch of people who make decisions about what happens in the rest of the world, we're going to go backwards. We're not even going to incrementally go forwards. We're actually going to go backwards. So the voices, as you say, Ms. Tuzi, about the voices from the Global South are critical. And we are very, very fortunate to have organizations like PACTURE, to have organizations like AMREF, to have really superb spokespeople from ministries of health in African countries, such as Minister Chiponda from Malawi, Minister Kolsek from Senegal, who stand up and publicly advocate for the reality of their country, which is that these countries are being destroyed by climate change. So health policies in Malawi, every single health policy is informed by climate. There's no health policy in Malawi now under Minister Chiponda's rule, well, she's minister, which does not recognize the impacts of climate change on that country's ability to respond. And so I'm very fortunate to be able to speak to Minister Chiponda. She was in the welcome last week, and I see Minister Kolsek on a committee that I'm on regularly, and this is a fantastic opportunity to hear those voices. Our calls, our research calls now increasingly ask for locally led research tackling local issues. And the centers you mentioned, so we're about to announce 3 major centers in Africa, centers for research and policy. They will set the agenda for research and policy. I won't. What do I know? So those will be set by the researchers and the policymakers in country to make sure that the research is relevant and the policy solutions are locally and context specific. That is so important. So we are driving that sort of mission, that sort of vision with our peer philanthropies, both in northern context, but also increasingly, as I say, from low and middle income countries, to recognize, that's the ethos that we are trying to spread and trying to use our convening power to do that.
Fantastic. Thank you for that. Thank you so much for your comments. I think ending on that, if we don't take this moment now to really drive forward the regionally led, country-led plans in all areas, then we will have done a great disservice to history. And so I think that, that point is something that, if anything, we hope you all take home with you. But I'm being told I think we're over time for our panel, but we do want to open up to the audience for a few questions, but maybe a round of applause for our panelists in the conversation. Thank you so much. Do we have time for a few questions from the audience? I'm not seeing, so maybe 3 questions. There's a microphone that's around. Any burning questions, any contributions from your own experience on the intersections of climate and health? Yes, please, if you don't mind just saying hello and introducing yourself.
Yeah, I'm Johannes Waltz. I'm with Merck, which is the company in the private sector, pharmaceutical sector, dealing and combating one of these unpronounceable NTDs, schistosomiasis. And of course, schistosomiasis undoubtedly is affected by climate change. We know that, but we don't know the extent. It's both spectrums, or both sides of the spectrum. Climate change dries out waterways, means less infection points, but it also causes flooding, means more infection points. We don't know the dimension, and that is something I think we really need to get to grips with. We need to understand it much better in order to somehow tackle it together, considering that climate change is the unavoidable big issue we all have to deal with. At the same time, so funding for that is required. And at the same time, forgive me if I can't help but also talking about the other funding issue, which we are all, and many of us here in this audience, I think, have to deal with, namely the impact of the closure of USAID. USAID had a climate policy. It had big climate change action sort of and interventions in their own right. But of course, at the same time, we are currently faced with a situation where we, as a donor, the key donor of the medicine used to combat and treat schistosomiasis, have the product, but we don't have the funding to get it down the last mile because US aid, as we all know, has been closed down effectively. So funding, philanthropists, please step up to it, whether it's for climate change or whether it's for implementation of existing medicines to tackle the health aspects of NTDs. Thank you.
Thank you for those comments. Yes, the funding situation now really drives the private sector and philanthropy to step forward, and we know that the resources are there. It's just looking for the most effective mechanisms for getting those resources applied to these issues. Ngozi, I see your head. Nice to see you. There's a question down here.
Thank you so much to the panelists, and thank you, Mireille. My name is Ngozi Arandu. I am the Technical Director at the Global Institute for Disease Elimination, which is based in Abu Dhabi. I've really enjoyed this panel. I really was struck by what you were saying about us all needing to be more comfortable with the word inter. And as a recovering academic, I understand the importance in research, but I'm curious about, the reality at the government. We're all talking about this, but when it comes to the government, and I'm very curious to your experience in civil society and advocacy, how easy is it to have the health minister working with the agriculture minister? And you were saying that in Malawi, climate has to be part of all of the health policies. But I'm curious to, other sectors, are they considering it, and how well are we working together? Because another word that is being thrown around a lot is integration, and we keep talking about it in the health sector, but I'm not sure that we're really doing it. So I'm just curious to the panelists' insights about what's actually happening on the ground. Thank you.
Thank you so much. Would you like to take that, Muteka?
Yeah. So, yeah, I think when you talk about the health ministers and how we work with them, the influencing, there are so many factors which come into play. First and foremost, you understand the relationship, particularly I'm talking about in Africa, to give you just a very practical experience where we have been having for the last 3 years, having a convening on climate and health conference in Africa. And largely, the target of that has been how do we constructively engage the government in an environment where there is quite huge mistrust between civil society and the government, and the shrinking civil society space in not only in Africa, but even globally. And this then brings me to the current, even at the in the global north, where there is this phenomenon of the rise of the right-wing movement, which do not believe in climate, for instance. We leave alone talking about climate justice, the climate deniers. And of course, this comes with really the prioritization. They prioritize more war, they put more money into war. Look at what is we hand funders, leave alone the US aid. We end funders, and actually this has really, there is that global shift, even countries, Scandinavian countries, which used to support progressive ideas like climate change, like immigration, like human rights and democracy and those others, you find them, they are shifting, and right now their priorities, for instance, Ukraine. Before the collapse, even before Trump came, the US you could find in 2 years ago, they announced $95 billion to fund Ukraine war and to fund the Hamas-Israeli war and Taiwan, $95 billion. But when they were asked to support in Dubai, the US contribution was only $17 million. So you find, where is the priority? Is it climate priority or is it war? So those lopsided and the shifting the priority, topical issues in the world. So that's where, in the gap which we are talking about, the philanthropies can really not cover. It's not possible to cover the US contribution, which was accounting for leave alone when we talk about health, but in the entire, development end, 40% has gone. And so where are we going to put the priorities? So then coming then to this question then is how do we motivate, how do we capture the government? So for us, it's about really constructive engagement. But again, you need to look into, even if we talk about Malawi, the turnover, this depends on the relationships with the individuals within government. It takes a long time in cultivating that relationship. But all of a sudden, you find there was an election, the people you were in contact with within those ministries are gone. You will have to go back to really cultivate that relationship once again. So what we need then, the solution to that, is ensuring that you have multi-stakeholder, intergovernmental, and collaborations which exceeds the government, both at local level, and that's where we bring now the centers which you are promoting, and then linking them with the existing platforms like what we have, so that now they outlive individuals within government. So that's actually a very practical example of how we are trying to now overcome the challenges, even with these collaborations, even if we really value them, but they face challenges of continuity, because continuity is very important. We have said again, we are not going to solve the climate problem with an event, nor a small process. Sometimes you see when you talk about the NDCs, the next one is actually 2035. So how are we going to ensure that we position ourselves to avoid that kind of just event kind of actions, or outliving individuals, so that now we have that process which delivers the change which we want.
Thank you so much. What a wonderful note to end on. I think us taking forward, how can we rethink the way that we've been doing things, especially in this moment where we're going to have to more effectively use resources in an integrated way, while thinking about making sure the capacity in the communities in which we want to see the change and support the change stays there and remains there, whether it's through science or policy or in philanthropy. There are many wonderful regional philanthropic initiatives that are coming forward as well. And so thank you so much for spending this time with us this evening, for choosing to be here and drinking some wine instead of outside on the sidewalk. It was such a lovely day. So thank you for spending some time with us, and we wish you all the best. Feel free to hang around and discuss further. I think this is a challenge for each of us to rethink and double down on what we're doing to accelerate the changes that we want to see in climate and health. So thank you.